Zadru Zuzpe, Dobro, Pozolovat, Physiopoetry with Alhassan. Before you guys panic and look for any subtitle or language change, let me tell you why I am speaking in Russian. It is because of our today's topic for this video is Russian current. So, welcome to Physiopoetry with Alhassan और आज हम सीखेंगे Russian current के बारे में. So, without further ado, let's begin. As the name suggests, Russian current, it was developed in Russia by a Russian physiologist, Dr. Yakov in 1977. अब Dr. Yakov, why did he invent this Russian current and what was the reason behind inventing the Russian current? So in that time where the Russia was very powerful, it was known as the Soviet Union, and at that time the athlete of Olympic Soviet Union team, they were using this Russian current to enhance their muscle performance. It wasn't a kind of a doping or anything illegal. They were just using a electrotherapy to enhance their strength. And if we talk about the 1980 Summer Olympic, which was held in Moscow, we all know the records that Soviet Union has gained total 80 gold medals with total tally of 195 medals. So, was it the reason? Definitely. And it is scientifically proven that Russian current does enhance the muscle strength. It is helpful for building the muscle strength if we use Russian current along with the manual exercise, along with the strengthening exercise. So let's learn more about the Russian current. As we all know till this point that it was developed by a Russian physiologist, Dr. Yakov. What is Russian current? It is a medium frequency current with a frequency of 2500 Hertz. So it comes under the range of a medium frequency current. So it is a medium frequency evenly alternating current which we apply in a series of a burst. ये क्या होता है हम ये समझेंगे. सो एक मीडियम फ्रीक्वेंसी करंट है, उसकी जो फ्रीक्वेंसी की रेंज है, एज वी ऑल नो फ्रीक्वेंसी जहां पे एक सेकेंड में नंबर ऑफ पल्स कितने पास होते हैं उसे हम फ्रीक्वेंसी कहते हैं. सो द फ्रीक्वेंसी की जो रेंज है इट इज लाइज इन द मीडियम फ्रीक्वेंसी रेंज. सो इट इज अ मीडियम फ्रीक्वेंसी करंट. मोस्टली वी यूज IFT एंड रशियन करंट एज अ मीडियम फ्रीक्वेंसी करंट. बट यहाँ पे क्या होता है कि यहाँ पे हम 2500 हर्ट्ज की जो फ्रीक्वेंसी होगी, फॉर एग्जाम्पल जैसे मैंने यहाँ पे ड्रॉ किया हुआ है, प्लीज कंसिडर दिस एज एन इवनली अल्टरनेटिंग करंट. एंड रशियन करंट इट इज अ पॉलीफेजिक साइन वेव. तो एक साइन वेव बनाता है, दोनों फेज में है. एक फेज में होता है उसे हम डायरेक्ट करंट कहते हैं अगर एक ही फेज में है, और यहाँ पे फेजेस चेंज हो रहे हैं. सो इट इज एन इवनली अल्टरनेटिंग पॉलीफेजिक साइन वेव काइंड ऑफ अ करंट. सो अगर हम ये मान के चले कि ये एक हमारा वेव है, यहाँ पे एक सेकेंड में 2500 वेव्स पास हो रही है, सो इट हैज अ फ्रीक्वेंसी ऑफ 25 हर्ट्ज. ओके, तो हम रशियन करंट जो देते हैं वो हमेशा एक बर्स्ट में देते हैं. वी नेवर अप्लाई द रशियन करंट एज अ होल. वी अप्लाइड इज अ सीरीज ऑफ अ बर्स्ट. मतलब कुछ टाइम के लिए देयर विल बी सम फ्रीक्वेंसी, देयर विल बी सम वेव्स. तो उसके बाद कुछ टाइम के लिए देयर विल बी नथिंग. अगेन इट विल बी इन अ सीरीज ऑफ बर्स्ट. तो अगर मतलब पूरी वेव रहेगी तो वी विल बी अप्लाइड इन अ चंक. पहले थोड़ा सा रशियन करंट ऑन पीरियड रहेगा जहां पे रशियन करंट लग रहा है, जहां पे अल्टरनेटिंग मीडियम फ्रीक्वेंसी करंट मिल रही है टिश्यूज को. देन देयर विल बी एम्प्टी एंड ऑफ पीरियड जहां पे वो बिल्कुल नहीं मिल रहा. अगेन वहां पे एक बर्स्ट मिल रहा है. सो what happened in burst? We applied 50 burst per second. एक सेकंड में 50 burst देते हैं, उसके बाद डेफिनेटली थोड़ा सा रेस्ट पीरियड आता है. एंड देयर आर 25 पल्स इन अ बर्स्ट. एक पल्स के अंदर, एक पल्स में देयर आर एक बर्स्ट के अंदर देयर आर 25 पल्सेस. और ऐसे हम टोटल 50 बर्स्ट देते हैं ड्यूरिंग अ ट्रीटमेंट ऑफ व्हाट यू से इन 1 सेकंड वी अप्लाई 50 burst. So Russian current में ऐसा क्या है? What is the special in Russian current which is helpful to strengthen the muscle, to gain that advantage which the Russian athlete have used, which they gain a good result in recovering of their muscles and strengthening of their muscles. तो रशियन करंट क्या करता है? चूंकि इसके पास मीडियम फ्रीक्वेंसी करंट है, थोड़ा सा हाई फ्रीक्वेंसी है फ्रॉम द जो कंडीशनल कंजर्वेटिव हम जो लो फ्रीक्वेंसी करंट यूज करते हैं. सो इसमें क्या होता है, दिस मीडियम फ्रीक्वेंसी करंट विल बी अप्लाइंग ऑन द मोटर यूनिट. तो मोटर यूनिट का जो मैक्सिमल कॉन्ट्रैक्शन है वो करवाएगा. कैसे? इट विल बी दिस इलेक्ट्रिकल स्टिमुलस, इट विल stimulate, it will activate almost all the motor units. मसल के आसपास जितने भी मोटर यूनिट्स है उन सभी को एक साथ एक्टिवेट कर देगा, जिसकी वजह से क्या होगा कि ऑल द मोटर यूनिट्स विल बी स्टिमुलेटेड सिंक्रोनसली, एक साथ साइमल्टेनियसली वो सिंक्रोनाइज होंगे, एंड ऑल द मोटर यूनिट विल फायर एट द सेम टाइम, एंड इट विल कॉज द गुड अमाउंट ऑफ कॉन्ट्रैक्शन ऑफ अ मसल. When we do a strength training, when we are strengthening a particular muscle, what do? We strengthen that muscle, we contract that muscle. So by using that contraction, the muscle is getting strengthened. So वही सेम चीज हम यहाँ पे करंट के थ्रू कर रहे हैं. We are applying the same amount of impulses, slightly more amount of impulses, so it will stimulate all the motor units, almost all the motor units. Now if all the motor unit will fire at a synchronized way in the same time, so it will cause more contraction, which is more than a physiological possible for us to do. So if I'm doing a bicep contraction, तो यहाँ पे मैं जब muscles को contract कर रहा हूँ, I am stimulating, I am contracting, I am giving signal to n number of motor units. But when I am applying the same Russian current to the same muscle belly, तो वो शायद उससे भी ज्यादा motor units को stimulate करेगा at the same time. So as a result of that, the muscle will get a good amount of contraction, and because of this contraction, the muscle will get strengthened. Okay, so the same principle, the same thought process was there of Dr. Yakov kots. तो उन्होंने यही same principle use किया in enhancing their athletes' strength. Okay, so इसका एक training protocol है. There is one training protocol. What happened in that? It follows a 10-50-10 rule. So what is this 10-50-10 rule? So in this, when we apply a Russian current, so the 10-50-10 rule says कि we apply, I'll write it here, 10, 50 and 10. So we apply the Russian current, we apply the current for 10 seconds. 10 second current is on, current we are applying. 50 second is the rest period. So we are applying the Russian current for 10 seconds. After that, for 50 seconds, it is a rest period. The muscle is in relaxed position. It is not getting any contraction or any stimulation. And we repeat it for 10 times. So on, off and repeat. It doesn't rhyme, but it is the training protocol of a Russian current. How we will apply it. Mostly इस तरह से apply करते हैं हम. One thing I forgot to mention, then while applying clinically, we use a 70 milliampere amplitude while in this Russian current, and we use 2500 frequency of hertz. So this is a basic training protocol. Here I have drawn a image that it is an alternating, evenly alternating. Please ignore the unevenness in my drawing. I don't follow the rule of perfection. So there is a good thing about perfection is imperfection is good. So it is an evenly alternating medium frequency current. So it is a series of bursts. So it is a whole. So here we will apply it as a series of bursts. So here we will apply it for some small portion. A burst will be given for 10 milliseconds. Again for another 10 milliseconds there will be a gap. There won't be any current. For next another 10 milliseconds we will be applying the second burst here. So Russian current we will apply in a series of bursts with a gap in between. Okay. Moving forward, we apply the Russian current for 10 minutes of period of time, and we can apply it daily for weeks, up to 3 to 6 months for proper muscle training. But one thing we have to note here, that along with Russian current, strength training is also important, because electrotherapy, this current will help you to boost, but you have to focus on the strength. And this is what the Russian athletes have did. It is good for recovery. It will help you to recover. It will help you to strengthen your muscles. But you have to do that weightlifting. You have to do that hard training, and this will help you along with it. Moving forward, what are the physiological effect of Russian current? So the Russian current give effect on both sensory nerves and motor neurons. when we give a sensory, when the stimulation to a sensory neurons, what will happen? It will give you a sensation of pricking. You will feel that sensation. You will feel the sensation that something is pricking you. And on a motor nerves, it gives a tetanic contraction type of sensations. So it acting on a both sensory nerves as well as your motor nerves. On sensory nerve, it is giving a pricking type of sensations, and because of it is applying on a motor nerve, so it is giving a tetanic like contraction and a pricking like sensation due to the sensory nerve fibers. They will carry this sensation. And one of the good thing about the rushing current is it is the sensory neurons which are carrying the sensation of pricking sensation. It will block the gate over your spinal cord. So it will be painless because the gate is already blocked. I have already made a video on a pain gate theory where I have discussed about this gate. I will provide the link in the description. You can check that out. So the gate will be closed. The substances related to nosar, the gate will be closed because sensory nerve fibers are coming up towards the brain and they are blocking this pricking sensation. They will block the pain sensation. So यहाँ पे क्या हो रहा है कि जो रशियन करंट है फिजियोलॉजिकली आपके सेंसरी और मोटर न्यूरॉन्स दोनों पे अफेक्ट करेगा. उसकी वजह से हमें प्रिकिंग सेंसेशन मिलेंगे और मोटर यूनिट को भी हम वो स्टिमुलेट कर रहा है. इसकी वजह से हमें टिटेनिक लाइक कॉन्ट्रैक्शन मिलेंगे. नाउ व्हाट इज अ टिटेनिक लाइक कॉन्ट्रैक्शन? जैसे कभी आपके मसल ट्विच करते हैं व्हेन दे आर फटीग, स्पेशली काफ में हमें ऐसा फील होता है वेयर वी हैव वॉक्ड अ लॉट, जब हमने बहुत ज्यादा काम कर लिया है एंड दे हैव दैट कॉन्ट्रैक्शन, मल्टीपल स्टिमुलेशन इज बीइंग अप्लाइड, इट इज गेटिंग टाइटन ओवर देयर एंड हमें क्रैम्प जैसा आता है. तो इट इज सम सिमिलर काइंड ऑफ दैट काइंड ऑफ अ सेंसेशन, दैट काइंड ऑफ फीलिंग बिकॉज ऑफ अ मोटर नर्व स्टिमुलेशन. Now, what are the therapeutic effect of rushing current? Sorry. So it will improve the muscle strength. Definitely. The main purpose, the main indication of using the rushing current is to improve the strength of a muscle. So it will improve the muscle strength. For this, you have to set the frequency to the 50 to 70 hertz. The beat frequency should be 50 to 70 hertz. The pulse duration should be 150 to 200 milliseconds, and then it will reduce the muscle spasm. The second therapeutic effect is it will reduce the muscle spasm. For that, you have to set the frequency of 50 to 70 hertz. The pulse duration should be 50 to 175 microseconds. The on-off ratio. On-off ratio means कि कितनी seconds के लिए आपका current apply हो रहा है. It does apply in Russian current also, and we also discuss on-off ratio in ultrasound also. So what is this on-off ratio? On ratio of ratio मतलब कितने सेकंड के लिए वो करंट ऑन रहता है, कितने सेकंड के लिए वो करंट मिल रहा है पेशेंट को. That therapy is getting towards in the skin of a patient, so that portion, that time duration is known as on period. If I am talking about a 60-second cycle, तो 10 second अगर on period है, अगर हम यहाँ पे बात करें, so 10 second is a on period, it's a on portion. The 50 second is the off period. So on off ratio इसे हम कहेंगे कि there is a 10 second on and then 50 seconds on. This is a on off ratio. There is another term which we mostly use is a duty cycle. Duty cycle is nothing but just a portion, how much percentage you are having that on period time. So how we will calculate? We will simply, if we want to calculate the duty cycle for the on period, we will write it here. For on period, divide by on period plus off period. That means a total time. Okay. For example, if we are applying the current for 10 seconds of time, so we will write it here. 10 second divided by 10 plus 50, which is 60. So 10 plus 60 gives us 1 by 6. So this percentage will be denoted as a duty cycle of that particular machine, that particular treatment. Okay. So according to that, the on-off ratio to reduce the muscle spasm, the parameter we will set as a 5 to 12 second on period and then 18 to 15 second of off period. To reduce the edema, we will set the beat frequency to 35 to 50 hertz, and the pulse duration will be 400 microseconds. The on-off ratio should be 1 to 2 second on and 1 to 2 second of off ratio. And the time we can give is 10 to 15 minutes if you want to reduce the edema. Now, how it will reduce the edema? See, if there is a swelling around a muscle, and if we contract that muscle, if we give good amount of contraction, it will move the fluid. So the edema will get reduced. There will be some pumping action around that part with the help of that muscle contraction, the external stimulus which we are giving from the help of Russian current. The muscle is getting contracted, it is having that pumping effect, it will move the fluid around it. And once the fluid is moved, and it can get easier to excrete or to remove it from there. Now, for the indications, we can apply it over the weak muscle, we can use it for the strengthening of a muscle, we can use it after an ACL reconstruction, after ACL injury to regain that strength, we can use it to train the athletes. So there are main purpose of Russian current is to build a strength of an athlete, build a strength of muscles of an athlete, and after any surgery of a ligament, after any injury, the patient, the athlete, the patient is recovering. In that time, we can use the Russian current along with a traditional strengthening protocol. Now, what are the contraindications of Russian current? You should not be applying over abdomen and back region of a pregnant lady, lumbar or abdomen region. We should not apply to the anterior cervical area where the carotid artery is situated. We should not apply over there. We should not apply it over the transthoracic area. We should not apply it over the hemorrhagic area, some neoplastic area जहाँ पे cancer cells grow कर सकते हैं. These are the basic things. We should not apply over a metallic implant. Definitely, it is given in your books that we should not apply it over any metallic implant. It can cause burns. We should not apply it during if the skin is very sensitive, if the patient is having any allergy, if is there any problem, we should not apply it over those are reasons. So there are basic contraindications, and Russian current is very important according to your academic point of view. Yes, there are very rare chances that we don't use more in clinical practice, but yes, it is very effective, and there are few physiotherapists which I personally know, they use this current, and some of the therapists, they are not aware about this current, the effect of this current. There are some studies which have been given about the effectiveness of this current, and yes, the Russian use it, and it is used in many parts of the world. So this is a Russian current, and if you have any doubt, do let me know. It's a small portion, but for your exams it is very important. They always ask about Russian current because it carries good weightage for your exam. So whenever it is asked in exam, if they ask in a 7 marks or a 3 marks, you have to write accordingly. Generally they ask in a 7 marks, like just they write a Russian current, or they will write explain the Russian current. Mostly the question is like this only. Sometimes they do ask about the physiological as well as therapeutic effect of Russian current. At that point, if it is asked in a 7 marks question, we have to give some basic information, some introduction, and we will jump directly toward the physiological effect as well as therapeutic effect. What I have mentioned here, आप उसको थोड़ा सा elaborate भी कर सकते हो. You can mention the depolarization of a sensory nerve and depolarization of a motor nerve. उसको थोड़ा और explain करते हुए, there will be a pricking sensation, the afferent sensation will go to the brain. थोड़ा सा आप उसको add on करके लिख सकते हो. Therapeutic effect के अंदर, these are the parameters which you have to remember. There is no option in it. So yes, we have to remember these parameters and we can apply it to gain maximum benefits. There are basic contraindication which we generally follows over in a different current also. So those are the contraindication and indication. As I have previously said, we use it for strengthening of a muscle after any injury. For the recovery purpose, we use this along with a traditional strength training protocol. So that's all for today. If you have any doubt, do let me know in comments, and do share this with your friends, and do let me know how you like this video. If you need any correction, if you want any suggestion, if you want me to make a video on any other topic, please drop that topic in the comment box and I will definitely make the video on it. Thank you. Have a nice day.